Hey there! How are things going with your medical terminology class? Still breaking down complex words for aspiring interpreters?
You know it. It's actually one of the most rewarding parts of the job. It reminds me a lot of our days in the clinic, just from a different angle.
I completely agree. It's fascinating how much foundational knowledge we bring from our past lives, isn't it? Speaking of foundations, I was just thinking about a word that's so central to everything we used to do, and still do now in a way: diagnosis.
Diagnosis, the bedrock of patient care. It's such a powerful word, and honestly, understanding its roots helps so much, especially when you're explaining it to someone new to the field or interpreting for a patient.
Right? It's more than just identifying an illness. When I'm teaching, I always start with the etymology. Dia meaning through or apart, and gnosis meaning knowledge or to know.
Exactly. So, literally, it's knowing through or knowing apart. It's about gaining knowledge by looking through symptoms, tests, patient history, distinguishing one condition from another. It's not just a label, it's a process of deep understanding.
And that process is what's crucial for our interpreting students to grasp. They're not just translating words, they're facilitating the knowing through for both the provider and the patient. If the patient doesn't understand the diagnosis, then the communication hasn't fully happened.
Precisely. And it highlights the intellectual detective work involved in medicine. It's not a guess, it's an informed conclusion reached through systematic inquiry. It makes you appreciate how much critical thinking goes into every single patient encounter.
It also connects to our everyday lives, doesn't it? We diagnose problems all the time, even if we don't use the medical term. Like when your car makes a funny noise and you try to figure out what's wrong with it, you're gathering symptoms to reach a diagnosis.
That's a perfect analogy, or even trying to figure out why your internet isn't working. You check the modem lights, test different devices, restart everything. You're going through the available information to know the problem.
It really shows how a word that seems so specific to one field actually describes a fundamental human process of problem solving and understanding. It's about careful observation and drawing conclusions.
And that's what makes teaching medical terminology so much fun. It's not just memorizing words, it's uncovering the layers of meaning, the history, and the broader application of these concepts. It empowers our students to truly understand, not just translate.
It certainly does. It gives them the context they need to be effective communicators. So, next time someone asks what diagnosis means, we can tell them it's about the journey to knowledge, not just the destination.
Absolutely. It's about knowing the patient, knowing the condition, and knowing how to communicate that knowledge effectively. A truly fascinating word.